If we move proximally to distally, the first joint of the shoulder complex would be the sternoclavicular joint. Obviously, the name tells you what bones are joined. It's the joint between the sternum and the clavicle, and it is truly the only direct bony attachment of the upper extremity to the axial skeleton. So it really is the only true connection, solid connection between the upper extremity and the body. So it is a joint that is under a lot of stress and under a lot of tension all the time. The whole weight of the upper extremity basically is, being supported by this joint. And it does it incredibly well because you hear very infrequently of injuries to this joint, overuse injuries, arthritic changes, and so on to this area. So this joint functions very well for the types of stresses it's placed upon. The greatest stresses occur when we fall, on an outstretched hand and force travels up the upper limb and then passes through the clavicle to this joint potentially. But again, it does its job very well. So let's take a look at its structure, both from a bony perspective and connective tissue. So the sternoclavicular joint, again, is the union here from the clavicle. The clavicle's been obviously truncated here, and we can see the clavicle fits into this notch on the sternum. So this is the connection between the upper extremity, the bony connection between the upper extremity and the axial skeleton. It's a saddle joint. When you learned about joints in the past, there were different types. Saddle joint was one of the least common types of joints in the body. The only other place we see it is in the thumb. And it's called a saddle joint because it looks like a rider sitting in a saddle. And we could see that the sternum, or the proximal end, or the superior end of the sternum, is called the manubrium. It's convex in one direction, concave in another, kind of like a saddle. A saddle on a horse, where it is concave from anterior to posterior and convex the other direction. And then we have the same shapes, but in opposite directions on the clavicle. So they fit together very nicely, forming this saddle joint. A saddle joint is a joint that allows for 3 degrees of motion. So it allows motion in 3 different planes. So even though this joint is very stable, does its job very well, it still affords motion in 3 different directions. So pretty good range of motion for how infrequently it's injured. And that's because the saddle joint inherently is a fairly strong bony structure. Now, the motions that are allowed at this joint that allows 3 degrees of freedom are elevation and depression, protraction and retraction, and rotation. And remember, as we said in the previous presentation, this clavicle moves along with the scapula. So when the scapula moves, the clavicle moves. So when the scapula moves into elevation, the clavicle moves into elevation, and so on. So when you shrug your shoulders, for instance, the scapula slides upward, and the clavicle is going to move at this joint as the pivot, and the clavicle itself, the distal end of the clavicle, will move upwards. When we protract the scapula, which is moving the scapula away from the midline, moving it kind of anteriorly along the lateral aspect of the rib cage, the clavicle will also tilt anteriorly at the sternoclavicular joint. And then when we do upward and downward rotation of the scapula, we get some rotation of the clavicle as well, although the amount of rotation afforded the clavicle is fairly small. So the clavicle, therefore, we can see now is again a saddle joint with motion that can occur in 3 different planes. The structure of this joint, in addition to being a fairly stable bony structure, we see a very, very thick joint capsule and thickenings and additional ligaments. So the structure of the sternoclavicular joint, again, good bony-wise, but also has a lot of ligaments to help hold it together. So the sternal end of the clavicle meets with the clavicular notch of the sternum. Those are the bony surfaces. And then it's going to be held together by a variety of ligaments. The purpose of this joint, again, is to allow for motion of the shoulder girdle, but also provide a stable base of support for the upper extremity. It also helps to absorb forces that are transferred along the clavicle, typically occurring from or resulting from some impact or force being applied to the upper extremity. So when you fall and land on an outstretched hand, that's what we see as the force comes up the forearm bones, it comes up the humerus, and then gets transferred through the clavicle to the sternum. And again, it does this very, very well. So the joint capsule of this joint is, again, going to encircle the entire joint. Inside the joint capsule is synovial fluid. We also have an articular disc between the bones, which I'm going to talk about on a future slide. And then thickenings of the joint capsule that are called ligaments. And these ligaments are really pretty strong, and the reason why this joint is injured or dislocated very infrequently. Because of its position, again, remember the clavicle is in a very important position in that it protects jugular vein, the carotid artery, the brachial plexus, a collection of nerves sits behind it. So the clavicle, if it was dislocated, it is risky if we have a posterior dislocation or if we have a fracture that was to protrude posteriorly, because there's a lot of really important structures you don't want to be poking. And again, that rarely occurs. This joint is very strong and stable. But let's take a look at the ligaments. And the ligaments are all named, I think, in a nice way because they tell you what they connect, right? So the first ligament we're going to look at is the costoclavicular ligament. The costoclavicular ligament, costo means rib. So the costoclavicular ligament we see here, and the costoclavicular ligament connects the first rib to the clavicle. So it keeps the clavicle from moving in an upward direction, so preventing it from separating from the manubrium in a superior direction. Keeps it tight in that joint. The interclavicular ligament, interclavicular means between the clavicles. It actually runs from one clavicle all the way down, attaches to the manubrium, and then over to the other clavicle. So also, again, holding the clavicle tightly to the manubrium, to the sternum, keeping it in place. And then there's a thick ligament on the anterior aspect of the sternoclavicular joint. It's called the anterior sternoclavicular joint, or sternoclavicular ligament. And again, it's shown here, and again, forms a nice thick barrier holding these two joints, or these two bones together, keeping them from excessive motion. So these ligaments do have some slack in them and allow for some movement of the clavicle, but they are very thick, so once they get tight, they do a very good job of holding this joint together. The motions that occur at the clavicle, again, they are related to the motions of the scapula. So the scapula and the clavicle, for the most part, move together as a unit. There's a little bit of motion between the scapula and the clavicle at the acromioclavicular joint, but not a lot. So the motions that occur at the scapula are going to be elevation and depression. Elevation is when you do a shoulder shrug and your scapula moves upward. And what's going to happen there is the clavicle will stay fixed here at the sternal connection, but it will move upward at the distal end. Okay, so that's what happens during scapular elevation. During depression, the opposite occurs, and basically the clavicle moves downward back to the position it was in before you started elevation. So in an anatomically neutral position, you're already in a position of scapular depression. Protraction and retraction is the scapula sliding on the thorax. For the clavicle, protraction, the clavicle moves forward. So if we were to look from above, we would see the distal end of the clavicle move anteriorly during protraction. During retraction, the clavicle moves backward or posteriorly. And then rotation occurs in the clavicle in only one direction, and it rotates posteriorly. And that's when, again, we have an upward rotation of the clavicle or of the scapula during putting your arm up over your head and so on. So we do have some rotation, but it is somewhat limited. So the sternoclavicular joint does allow motion in three planes, primarily that upward and downward motion, which is called elevation and depression, and protraction and retraction. An important other structure I want to mention, because it is somewhat clinically relevant and functionally does a very important job, we have a disc, an articular disc, like a meniscus we see in the knee and so on. But this articular disc sits between the clavicle and the sternum, between the manubrium and the clavicle. That disc, like any other articular disc, does a number of important things. First off, it separates the bones, And because these discs are somewhat rubbery, can provide some shock absorption ability. So when we do fall on an outstretched hand, instead of bone ramming into bone at this joint, we have that disc between the bones that can help to absorb some force. The articular disc also does an important job in that it allows for smoother motion and acts as a hinge for motion. So it kind of assists in this pivoting of the two bones on one another in addition to absorbing force. So it's an important addition to this joint, both structurally and functionally.